I performed over 2,000 TMJ surgeries, open joint surgeries, and through the arthroscope surgeries on this joint until about 14 years ago, at which point I took a different track to do my own research on why there was so much confusion about TMD, TMJ. And then over the past 12 to 14 years, had an increasing amount of experience with my discoveries and treating patients non-surgically for TMD, TMJ. All told, I've probably done roughly 10,000 consultations with TMD, TMD patients who have the multiple symptoms of this problem. Not all of them went through treatment, but that's why I can pretty much construct about how many patients I have done consultations with, because I have personally successfully treated around 4,000, 4,500 patients non-surgically and 2,000 patients surgically. So that's 6,500 patients, and about 2/3 of the patients that I have done consultations with have carried through treatment, both surgical and non-surgical. That makes about 10,000 consultations. So with that alone, I have a little bit of experience regarding this problem, and certainly the vast majority of those patients came in with some kind of history of joint TMJ joint noise. All right, with that as a background, what do patients think about this problem? Well, for the most part, they are very concerned when their joint starts making noise. In the earlier years, it's very common. It's so common, I almost expect it and can trace it back. Even when I see a patient who has had TMD symptoms for 30 or 40 years, you can almost count on the fact that the way in their earlier years, in their mid or late adolescence or early 20s, they experienced some type of clicking of the temporomandibular joint.